Hello, my name is Dr. Derakhshani, and I wanted to introduce myself to you today. I've been a chiropractor since August of 2003 and a acupuncture practitioner since December of 2011. Um, the reason I got into chiropractic was because when I was about 19 years old, I was in a car accident where it was not my fault, and both cars were unfortunately totaled. I ended up getting a referral to another chiropractor, and when I went in, I really liked his office. It was a very happy place to be. He was a very friendly doctor as opposed to all the other doctors that I'd ever been to as a child. It was very quiet and kind of somber. So this was a lively office. It was just very different than what I was used to from before. And I didn't even know what a chiropractor was, to be honest with you. I'd never heard of a chiropractor. So my friend said, hey, go see my chiropractor. The doctor was a fitness guru and sports. He played sports, had a very successful practice, and I just liked being in that office. He taught me a lot about exercise and bodybuilding at the time, which was back in the mid 90s. So I like that aspect, the sports aspect of chiropractic, and how he was able to teach me some techniques to keep me out of pain. But anyway, so I asked him. I said, well, how did you know you wanted to be a chiropractor? And he said, well, why don't you take some anatomy classes? I was in college at the time. See if you like anatomy and biology. And I did, really well compared to the other classes that I was taking. I really enjoyed the anatomy and biology classes. So I decided I wanted to be a chiropractor, and finished college, went to a chiropractic school in Los Angeles, California, and in 2003 I graduated. My practice is really geared towards sports injuries or just everyday injuries, car accidents, headaches, really any ailment that has to do with the musculoskeletal system. I like to both adjust by hand, sometimes by instrumentation. If somebody doesn't like to be adjusted, I don't like to force an adjustment on them. I will do more muscle work, myofascial release, active release technique. I also, after a few years of doing chiropractic, I learned that there is a limitation to what I can do. So I wanted to do more, and I had a friend that had started doing acupuncture, so I went to see him for a treatment, and it was like a miracle. I walked in with an injury, I walked out without an injury. And not every time that you get a treatment is it going to be like that, but what I've learned is that I can help as best as I can. I can do everything in my power to help a patient, and then the patient's body also has to take hold, and the injury also, how the level of injury and how severe it is will dictate how a patient responds to treatment. So just like anything else, if we are consistent, if we are work hard at where we need to go, then the injury will also respond, and your body really will respond, not the injury, but the body will respond to the treatment, and you will feel better faster. And sometimes, also what I've learned is I'm not necessarily the doctor that can help you. And then, so, if we do a few treatments, let's say 5 or 6 treatments, and you're not getting any better, then I have no problem referring out to another doctor, to a specialist, to a physical therapist. I've worked with physical therapists in the past. They're usually great at what they do. And so that's my philosophy. I will do whatever I can in my scope of practice and in my power to help my patients feel better and get better as quickly as possible, and teach you a few tips and tricks to keep you out of pain and out of the office, let's say. All right, so yeah, thank you. I look forward to meeting you when you come into the office.